My patients ask me about rhinoplasty, specifically open versus closed approach. So I prefer the open approach. The difference between a closed approach is the incision here. The only time I do a closed approach is people just need bridge work and do not need any work on their nasal tip. So if they're just needing a bridge work where they want to take off a hump, either bone and cartilage or both, they want to narrow the nose, you could do what's called an osteotomy, where you cut the bone and then narrow it. That's what most people want. They want their nose to be more narrowed than more wide. So if we look at an open approach, the advantage of that technique is, as I mentioned, it's much more accurate. If you're off by 0.5 to 1 millimeter on the nose, people can see that. So when we're doing reduction of the nasal tip in terms of the width, when we have to put a cartilage graft in, either something that raises the tip or makes the tip more narrow, we use cartilage either from the nasal septum or from the ear. When we're carving that and suturing into place, if you could see better as a surgeon, you're going to get a better result, and it's going to be more consistent. The negative thing about the open approach, and really, in my opinion, the only negative thing, you get a little bit more duration of edema in the supra tip, which means above the nasal tip area, so it lasts a little bit longer in terms of that. Doing nasal massage after surgery can help the edema improve more rapidly. So when we're doing the nasal rhinoplasty, we classically take cartilage from inside the septum first. Okay, we leave an L shape of cartilage to keep support for the tip, and enough cartilage from the dorsum. We're going to take that cartilage and use it as cartilage grafting. Often the cartilage grafting we do is along the columella from the nasal spine to the nasal tip for support. The most important thing for your house is structural support. The paint's extra. So the most important thing for the nose is a structural support. The other thing is the nose is a tripod. So this is the other two aspects of the tripod. We want to make sure that cartilage is strong enough. If it's not, we suture a piece of cartilage underneath your current cartilage, okay? While we narrow it, which rotates your tip up to the optimal position. In a man, it's about a 5 to 10 degree elevation. In women, it's between 15 and 20 degrees. In terms of the dorsum, we're removing bone or cartilage. We want that in a woman to be a little more curved than men. Men want a little more straight approach. Someone who might be Afro-American or Asian, sometimes they want an elevated height to the nose. The best way to do that is actually with a nasal graft made out of silastic. We can carve it. We have different sizes to put it in. We just make sure that the cartilage is covering the distal tip. You can get rib and use a rib graft to make the dorsum as well by cutting into little pieces and forming it. That has to do with rib surgery. So what we like to do with rhinoplasty is choose between closed and open approach to get the best aesthetic result.